SwipeRx.
Hello, good afternoon, everyone over here. My name is Wenki. I will be your moderator for today's session, provided by SwipeRx and also iNova Pharmaceuticals. Today, we have two topics, which is to soothing the sting, mastering the sore throat solution as the first one, while the second one will be painful mouth conditions, a pharmacy guide. Next, let us start with some housekeeping rules. All participants are muted, and please place your question in the Q&A chat box, and the moderator will gladly raise them during the Q&A session. To obtain a certificate and claim your CBD points, make sure to attend the webinar, this session, for a minimum of 2 hours, because we will record your time and will process the certificate for claiming after this. For any question or concerns, please email us at swiperxmy@gmail.com and we will assist you accordingly. Today, we have a special guest, Dr. Lam Sai Guan. Dr. Lam stands as a distinguished figure in the medical field, displaying an extensive career that spans over 16 years. He is a graduate of UKM, University Kebangsaan Malaysia, holding an MD degree. In 2018, he furthered his expertise by achieving specialization as a doctor of otorhinolaryngology, head and neck surgery, ORL-HNS, from the same institution. Dr. Lam's impressive journey began as a house officer at Hospital Selayang, Selangor, where he gained experience across various medical departments. His commitments to medical excellence led him to serve as a HOD, Head of Department of Emergency and Outpatient, during his tenure at Hospital Banting. He then further served in various hospitals in Malaysia, including Hospital Selayang, Hospital Sedang, Hospital Sultan Ismail, and Hospital Sultan Nora Ismail. As of 1st of December 2019, Dr. Lam has been serving as an ORL-HNS specialist at UKM Medical Center till now, solidifying his position as an accomplished specialist in the field. Let's put our hands together to welcome Dr. Lam for this session today. Dr. Lam, the stage is yours.
Right. Thank you for the kind introduction. Yeah, I feel shy listen to my own CV. And welcome everyone to this talk today. I'd like to thank Wenki again. I also thank iNova for the kind introduction, kind invitation to this webinar, and also thank you to SwipeRx for making this webinar possible and also look quite good. And I am an ENT surgeon, and more fancy, I like to call ourselves, laryngologists, and more specialized in head and neck oncology surgery. This is where I work at the moment at UKM Medical Center, with the main building of Hospital Chancellor Tuanku Mukris. And also we have another pediatric hospital called Hospital Pakar Kanak-Kanak just next to it. This is the disclaimer. So I go straight to the talk today, the throat. So that is a layman term or common term we refer to when we have any discomfort in our throat. But in our ENT, we like to refer the throat as quite specific to different parts. We call it a pharynx. Pharynx, it can be divided further according to the anatomical location. The top part near the nose, we call it nasopharynx. And the second part lower down near the back of the oral cavity, we call it oropharynx. And further lower down near the voice box or larynx, we call it hypopharynx. So any pathology in this region, patient can present as sore throat. And when you see this diagram, you know that the pharynx is an integral part of the body respiratory system and also digestive system. It's where when you eat the food will pass through the oral cavity, going through the back of the throat, then you go to the esophagus and you swallow into our stomach. At the same time, we can breathe through our nose to the back of the nose, then the air or oxygen will pass down to our voice box or larynx, and it further travel down to trachea, to the bronchus, and eventually to the lungs. But this pathway, the upper part is connected with the same similar, a shared common pathway, but when it's further down, it's divided into the esophagus and trachea. That's why the pharynx is very important as a coordinator, so that the food, when you eat, it doesn't go into the airway, which may cause aspiration. Symptoms of sore throat vary, depends on the cause. The patient may come to you complain of pain, a severe pain, or just a mild discomfort, or even just a scratchy sensation, or just a mild irritations that they feel at the throat. And this sore throat, it can be worsened when patient swallows food, because odinophagia. Patient have pain when they swallow, or they may have difficulty in swallowing certain food, especially solid food. We call it dysphagia. And patient may have a muffled voice. The voice you listen, the quality is not the normal voice. It's as something that patient holding at the back of the throat. We call it muffled voice. Or hoarseness. Hoarseness, the quality of voice is changed, but commonly due to the pathology low down in the hypopharynx or in the larynx. And in certain kind of infection, virus or bacterial infection, patients do tend to have an enlarged cervical lymph nodes or glands in the neck. They come to you complaining a nodes or lump they feel in the neck they're previously not present. So sore throat is one of the commonest complaint or presentations to primary care or even to the community pharmacists. Then we can see from this is the data from the US, upper respiratory tract infection, which including tonsillitis, pharyngitis, are one of the most common presentation. And this study in Malaysia, where they study in 12 public primary care clinics, and they collect the data. You can see that the most common one of the most common presentation is URTI, which include all the symptoms, rhinorrhea, and all that, and also sore throat. And the patient reason for, according to region, doesn't matter as Semenanjung or East Malaysia, is similar. And in our national primary care medical statistic, sore throat is also one of the commonest presentation. So you can see this one of the top 10 presentation, and upper respiratory tract infection, including runny nose, rhinorrhea, and no matter is public clinic or government or private clinic. Sore throat is one of the commonest presentation. Even sore throat in COVID is a very common presenting symptom, no matter the original variant or original strain or the new variant. As high as 50% of patients infected with COVID will present with sore throat. You can see it's one of the commonest symptoms patient present to you. And other than other symptoms, the headache, myalgia, or the upper respiratory tract symptoms, and other non-ENT symptoms such as fever, malaise, and dyspnea when the lungs is involved. Now we come to the one of the most common cause of sore throat, which is the inflammation of pharynx. We call it pharyngitis. When it occurs in a short onset of time, we call it acute pharyngitis. It simply just means the inflammation in the pharynx. So what patient may come to you other than sore throat is fever. Patient may have a fever, either low grade or high grade, but usually it tends to peak around day 3 to 5 of the illness. And if it's virus infection, it tends to resolve by itself by 10 days. And may have some other associated symptoms such as cough, flu, runny nose, or rhinorrhea. And if it's children, they tend to have close contact with someone who is not well, who is ill, who have sore throat or have some upper respiratory tract infection, then the virus will transmit to the children. And if it's getting more severe, patients start to have pain on swallowing. When you swallow, the food passes through the inflamed pharynx, it causes some discomfort or even pain. When you look in the throat, so you can simply just ask patient to open the mouth, or if it's difficult, you may use a spatula, tongue spatula to depress the tongue. Then you can see better at the back of the throat, usually the oropharynx region, and you can see the tonsillar region. So this is when you look at the picture, this is the uvula, soft palate, and the tongue at the 6 o'clock position, and left and right, you'll see the tonsillar pillars, and the posterior part is a posterior pharyngeal wall, or that's the oropharynx part. So in this picture, you can see this mucosal surface is a bit inflamed. It appears red and erythematous. The surface vessels are more prominent than usual because of the vasodilatation of the inflammatory process. And you can see the posterior pharyngeal wall, there's some lymphoid tissue, there's some cobblestone appearance because of the enlarged submucosal lymphoid tissue. And this erythema not only confined to the tonsillar area or pharynx, it may spread to the to involve the soft palate as well. So commonly, the cause can be divided into virus or bacterial causes, but virus cause is still the commoner compared to bacteria. The commonest virus are rhinovirus, coronavirus such as COVID, adenovirus, RSV virus, influenza, and parainfluenza virus. And common bacteria, the commonest that that occur, and you should be aware of, group A, beta hemolytic streptococcus or strep pyogenes. The rest are not so common, including all those atypical infection, mycoplasma, or those STD-related Neisseria, chlamydia. Then how do we differentiate whether it's a virus or bacteria pharyngitis? Because you may ask whether should I start antibiotic or not. So I can tell the symptom, it can be rather similar. Patient come to you with sore throat, there's a bit of prodrome, fever, cough, rhinorrhea. But if you really really ask the other related symptom, it may give you a bit of clue whether it's a virus or bacterial infection. Virus infection generally are self-limiting. They're quite mild, and it can be accompanied by prior runny nose and cough, some URTI symptom. And usually they come with some viral prodromal symptoms such as malaise. They just feel generally not well. Malaise, feel quite weak. Headache, or sometimes they can see some viral conjunctivitis at the same time. And bacterial cause tends to be more severe, and sore throat tends to be more severe, and fever can be persistent. It's not like it peak at day 3, day 4, then it comes out. It persistent because the bacterial infection takes some time and it won't resolve unless you treat the bacterial infection. And if you look at the throat, viral infection, it can just show a tonsillar erythema, a redness over the tonsil and the pharynx, and some cobblestoning of the posterior pharyngeal wall. And patient may have some enlarged cervical lymph nodes, and it's most common at the back of the neck. At the back of the neck, we call it level 5. It's been behind the muscles, and this tends to be a virus infection there. But if it's a bacterial infection, you can see the tonsil is more granular in surface, and the surface, the tonsillar crypts may have some exudates, and erythema may extend to involve the soft palate. And the cervical lymph node tends to be anterior at the lateral part of the neck, upper part just beneath the jaw, that we call level 2. And the nodes, if it's enlarged, it's tender, it tends to be a bacterial infection. Of course, to confirm, we need a throat swab to detect whether there is a presence of group A beta hemolytic streptococcus. And in some centers, they do have rapid test, rapid antigen detection testing. It's a point of care kit that can test a virus, some common bacteria and virus infection. Strep throat is caused by the commonest bacterial infection, the group A beta hemolytic streptococcus, or is actually a Streptococcus pyogenes. Why is it so important? Because it can develop complication. This strep throat is not as common as virus infection, but you must always watch out. It can occur in 30% of children and less in adult, about 15%. The complication also quite not uncommon, but it can be life-threatening. It occurs in 0.05% of children and 0.05% of adults. The thing, it may cause acute rheumatic fever. The patient may cause some vegetation in the heart and cause prolonged fever. It may glomerulonephritis, where it's an infection and inflammation of the kidney. From an infection, simple tonsillitis or pharyngitis, it becomes a peritonsillar abscess, a suppurative complication. And usually the sore throat is more severe compared to a virus infection, and patients have pain on swallowing or adenophagia. And the fever tends to be persistent, high grade, 58 degrees Celsius. And when you look in the throat, the tonsil is enlarged and may have some whitish exudates over the surface. And patient may come with enlarged cervical lymph node, that lateral anterior part. And other symptoms are non-specific, such as headache, nausea, vomiting, abdominal pain. And patient can have rashes. If it's streptococcus, if come to his sore throat, the throat is inflamed. You look at the patient's face or trunks or extremities, you notice there's some confluent or maculopapular rashes. There can be a scarlet fever that caused by group A beta hemolytic strep. There are a long list of etiology of sore throat other than the pharyngitis. It can be acute or chronic tonsillitis, a peritonsillar abscess, which there is a pus collection in peritonsillar space. Diphtheria is caused by diphtheria, a specific bacteria. Infectious mononucleosis caused by EBV. Fungal infections such as Candida albicans, supraglottitis, allergic rhinitis with postnasal drip, even laryngopharyngeal reflux due to GERD, or acute laryngitis, retropharyngeal abscess, or even tumors. Patient may have some sort of throat discomfort or sore throat. But I will not be able to cover all this, and we'll just cover the commoner pathology or etiology. So you can see the prevalence of group A beta hemolytic strep, or we call it GAS pharyngitis. And it's actually worldwide, quite common worldwide. So there's a systematic review that collect data from Web of Science and over 20 years. So the pool incidence rate of GAS pharyngitis was 82.2 episodes per 100 child years. What does it mean? In 100 children, it occurs in 82 out of 100 children in a year. I mean, almost a child will have one episode of GAS pharyngitis in 1 to 2 years. This is a study in Malaysia, a prevalent study, where they screened in adult patients to about 215 adults. Patients presented with sore throat. 65% of them were diagnosed as pharyngitis, but only 2.8% has GAS. Generally, the incidence of GAS pharyngitis, group A strep pharyngitis, around 2 to 5%. Not very common, but it's something that need to able to pick up, and if possible, to treat early to avoid the complication. So other than pharyngitis, the second most common cause of infection inflammation is acute tonsillitis. The tonsils tissue located at the oropharynx, but it's at the lateral side, at the left and right, in between two pillars. We call it anterior pillars and posterior pillar. So you can see the tonsillar tissue here. This one appear not inflamed or erythematous, so it's a normal tonsillar tissue. But when there is infection, the tonsil become enlarged because of the lymphoid proliferation. The tonsil tissue become enlarged, and you can see the surface is more erythematous. The erythema may even spread to involve the soft palate, and it may have a lot of secretion, and some have a surface whitish exudate because of the purulent process, purulent secretion. Tonsillitis is more common in school-age children and young adults, usually 20 to 30 years old, and it's rare in infants and those more than 50 years old. If an elderly or an adult more than 50 years old come to you with a sore throat, persistent sore throat, you should think of something more sinister rather than just a simple acute tonsillitis. The first we need to think of, could it be some tumor growing in the throat that cause patient having persistent sore throat. And most of these acute tonsillitis occurs caused by virus infection, less commonly by bacterial infection, the similar type of organisms such as group A strep, streptococcus, and others are staphylococcus, pneumococcus, and Haemophilus influenza. The appropriate treatment will depend on the cause. I will discuss later. The common symptom, the patient comes with a sore throat, difficulty or painful swallowing, high-grade fever with chills and rigors. Patient not only have throat, pain in the throat, they may have pain in the ear. Patient come, I have sore throat, after that I realize some pain in the ear. Actually, there's nothing wrong in the ear. Patient may have otitis media that due to the infection spreading from the throat to the ear, but commonly it's just a refer otalgia because of the shared innervation in the throat and the ear. And if the tonsil is large enough, patient may come to you complain of muffled voice, the change of voice quality, and bad breath because of the secretion and all the prevalent material in the throat. And as I mentioned, if you look in the throat, you find enlarged tonsils, it appear erythematous or red, with some surface exudates, a whitish like secretion or pus like in the surface of the tonsils. And the patient may complain that I have some painful lump at the neck because of the enlarged cervical lymph nodes. If the patient have very bad pain when the swallow cannot eat, cannot drink, they may come to you, especially children, they're high risk of having dehydration. So you can see if you have viral tonsillitis, the tonsil is enlarged and inflamed. It's not as bad, but if it's bacterial infection, you can see the tonsil is more granular looking with some whitish exudate on the surface. The redness may spread to the soft palate or even to the uvula and also the posterior pharyngeal wall. And when I'm preparing the slide, I was thinking whether I should include diphtheria or not, because it's not very common, but I think it's something that we should be aware of, especially when you are working in community. So diphtheria is once upon a time, a long time ago, almost eradicated. But recently, or about last 10 years, the incidence is starting to have some sporadic cases here and there, especially in Sabah, Johor, or certain area. So it's acute infection caused by Corynebacterium diphtheriae. It's spread by respiratory droplets and close contact. Okay, and more commonly occur in children. The incubation usually 2 to 6 days. The symptom usually quite mild initially, then patient develop more severe symptom, very the respiratory distress, especially the hoarseness, the change of voice because of the enlarged tonsil. Patient may have respiratory distress, appear more tachypneic, the breathing become fast, and there's some noise when they breathe. When there's some noisy breathing, we call it, or because of the blockage of the respiratory pathway at the throat. And the patient will appear ill because most of the time they are dehydrated because of severe pain in the throat. They have been not eating, drinking well for the past probably 5-6 days, then they start to get dehydration. And the enlarged nose can be very large because of the edema on the neck. In the picture below, you can see the entire neck, anterior neck is like swollen. They call it bull neck appearance. And when you look in the throat, you will see the throat, the tonsil enlarged, as it's not a whitish exudate, kind of spotty, whitish exudate. Instead, you see a white, a thick, quite a dense patch, like whitish patch covering the tonsil. Sometimes may extend even outside tonsil to cover the soft palate and uvula. Then you should think of, could it be diphtheria? We try to scrap out with any spatula, it starts to bleed because it's usually quite adherent to the mucosa. So diphtheria, because it's one of the diseases is preventable, then is the vaccine usually is included in our immunization schedule. 2 months here, we take it 2 months, a booster 3 months, 5 months, and another booster 18 months. But you can see that the incidence of diphtheria in 2021, 2022, there's no incidence. Then it start getting a bit more, and suddenly there's surge at 2016 because of some movement. There's some anti-vaxxer movement. At the time, they say vaccine caused a lot of child to develop autism, all those kind of thing. Then slowly the incidence become low, but recently it become high again, then high again because of the incomplete vaccination. So why are we so worried of diphtheria? Because it's something is preventable, but the complication can be very high. The mortality rate can be very high because it can develop acute respiratory airway obstruction because of thick pseudomembrane. Patient can develop heart complication, cardiotoxicity, myocarditis, and patient can develop neurological complication, the paralysis of not only the throat, even the central neurological deficits. So it's something to watch out if you think something is not just a simple tonsillitis. Please refer to a doctor so we can examine further. And if you are close contact with those patients with diphtheria, you need to be quarantined because you're high risk of contacting a diphtheria as well. The next one is peritonsillar abscess. Peritonsillar abscess simply just means, or sometimes we call it quinsy. Quinsy is an old term. It simply just means a pus collection from infection, inflammation of tonsil. Now it becomes pus collection. The prevalent material have accumulated, it becomes pus. And where it tends to accumulate, usually at just a space next to the tonsil, a peritonsillar space. There's a potential space between the tonsil and the underlying muscle. So we call it peritonsillar space. When the pus start collecting there, you start to push the tonsil more medially. You can see from the picture, the tonsil is pushed more medially, and you start seeing bulging, swelling over the soft palate. Usually it's unilateral. And it's usually occur in adult patients, rarely in children. So the constitutive organism is usually the same, the group A strep, staph, and can be, but most commonly is a mixed organism, aerobes and anaerobes. The symptom, severe suture. The suture can be quite bad, high-grade fever. The odonophagia quite bad because of the bulging of the soft palate, and patients tend to come with some muffled voice. We call it hot potato voice. Why is it hot potato? Imagine you are holding a hot potato in the throat, but you're not swallowing, and they try to speak. That's we call it hot potato. There's something stuck in your throat. You want to spit out, also cannot. You want to swallow, also cannot. Yeah, and the breath is really quite bad, called halitosis, and patient may have some pain referred to the ear and some limited mouth opening, called trismus. And examination, they find the enlarged tonsil, the soft palate can be congested with some erythema. You can see the bulging compared to the other side. The soft palate is bulged up, and because of this bulging and pressure, so the uvula is being pushed to the contralateral side, deviated to the contralateral side. So when you see this, you must refer because the treatment involves incision and drainage, not just a simple antibiotic. You need to drain the pus out, then we continue the antibiotic. Another common presentation to the pharmacist may be the aphthous ulcer, recurrent aphthous ulcer. It also called recurrent aphthous stomatitis. It's usually recurrent, multiple. It could be a small ovoid ulcer with a yellowish center surrounded by erythematous edges. It can affect up to 25% of the population, more common in female, onset in childhood and adolescent. That means they have this problem since young. It tends to recur. After that, there are three common types: minor, major, and herpetiform. Commonest are minor, where the ulcer is smaller, 4 to 5 millimeters, usually small amount, a number, not too many, less than 5. It will heal by itself, usually within 2 weeks. Major aphthous ulcers are not as common, but the ulcer is bigger. It can be more than 1 centimeter, deeper, and if it keep occur at the same time, it may cause scarring of the mucosa. And it may last for a longer time, more than 2 weeks, 2 months. And herpetiform ulcer is less common. It usually starts with small, but then a lot of the ulcer nearby, it coagulates, become a big ulcer. So what actually caused the aphthous ulcer is very common, but no one knows the cause, exact cause. There are many possible etiologies suggested. That why is it more common in female? It could be due to hormonal change, or it could be due to direct trauma, due to the dentures, or the sharp edge of the teeth, or it can be related to food. It could be nutritional deficiency, especially B12, zinc, folate, iron. It could be emotional stress, and those taking cigarette smokes, and GI disease, systemic disease such as celiac and Crohn's disease, and autoimmune disorders such as SLE or Behçet disease. And if patient are recurrent and ulcers, not only the patient recurrent upper respiratory tract infection, you should think of could the patient be immunodeficiency due to acquired HIV or AIDS. And if patient have on some chemotherapeutic agent, then because of the immunosuppressant effect of the drug. But I need to emphasize that please do not treat all oral ulcers as aphthous ulcers. If patient, an adult patient more than 40, 50 years old, no matter male or female, come to you with an oral ulcer that doesn't heal with symptomatic treatment more than 2 weeks, please refer to us to have a look, because it can be it could be a growth in the oral cavity or cancer. So if it's at the tongue, you need to watch out, because cancer most commonly occur at the lateral border of the tongue. It can happen in a small ulcer. You can see a very shallow, small ulcer getting bigger, or it become bigger, a proliferative and ulcerative tile tumor with central necrosis. All these yellowish surface are because of the necrosis of the cells. So if you see this, please refer to us, because you need to take a biopsy to confirm whether it's a cancer. Commonly, it's a squamous cell carcinoma. And in this picture, you see the ventral surface of the tongue. There's some whitish patch. This is a leukoplakia with some hyperkeratosis. It's a pre-malignant lesion, considered benign, but has potential to become a malignant. It needs to be excised. And this one, this picture, you see an ulcer at the lips, at the lower lips. The ulcer, it doesn't heal, and the ulcer become bigger and bigger. Then you should think of something malignancy. In this case, it's extranodal lymphoma that occur at the lower lips. The next pathology I'll discuss is oral mucositis, which is a inflammation response of the mucosa usually due to chemo or radiotherapy or the cytotoxic drugs, commonly due to antimetabolites, the 5-fluorouracil. But it can happen in other drugs such as platinum-based chemotherapy drugs, taxane, anthracycline, alkylating agents. And it may involve oral cavity or general or the mucosa over the GI tract. And it's quite common. 40% of patients receive chemotherapy develop mucositis, and up to 85% those receiving hematopoietic stem cell transplant will have some form of oral mucositis, because they need to have some immunosuppressant therapy. And what I see commonly is the head and neck cancer patient. Almost all, 90% of them, after chemo or during chemo radiation, they will develop some form of oral mucositis, whether it's mild or severe. And 19% of them may require hospital admission, because of severe pain, because of the infection, or because of the poor oral intake. They cannot even take because full of ulcer in the mouth. And this may cause delay in cancer treatment and even reduce the quality of life. The sign and symptom, there may be some erythematous mucosa. You can see multiple ulcers, very painful, very burning, pain of swallowing, and some increased thick mucus. And patient may start to lose weight because they cannot eat anything. So it's a grading by WHO from a simple grade 1. You can see just some redness, erythema, to start developing some shallow ulcer, or become a deeper ulcer. Patients cannot eat and drink. And even worse, a deep ulcer, the patient cannot take anything. Then in this case, we need to insert the nasogastric tube and start tube feeding. And then this one you may not see commonly in the community, but I see quite commonly in patient post-operation, especially those patients underwent general anesthesia that require endotracheal intubation, because of the inadequate neurovascular blockage, or because of the operator, or because of difficult manipulation intubation, or prolonged intubation, and or prolonged high endotracheal cuff pressure. It may cause discomfort. See, this is when we insert the laryngoscope for intubation. The tip of the blade may injure the throat, and it causes some edema. Sometimes it even cause bleeding. And after the operation, patient may complain that there's some persistent throat discomfort. Okay, so you see the tube. This is how we put in the tube to ventilate the lung during the general anesthesia for surgery to be carried out. So I come to the management of sore throat. It depends on the etiology. The management can be different. Symptomatic treatment is always indicated to relieve the sore throat and to improve the quality of life of patient. So this is based on the algorithm. So we ask the history, a simple, quick history, whether it's more point to virus infection or it may be a bacterial infection, especially the group A strep. So if it's viral etiology, then we just give symptomatic treatment. including all the fever antibiotic medication. Patient having throat pain can give some topical or gargles or spray or lozenges to relieve the sore throat. And this MAC-Isaac score, or sometimes you may see a Centaur score or modified Centaur score, or some even call it a Centaur and MAC-Isaac score. Actually, is almost similar. So this criteria is just, if it's present, the score will you recommend whether patient will need antibiotic or not. We see later in the following slide. Yeah. So another management symptomatic treatment, according to our Malaysian CPG, it's quite old, almost 20 years ago. There's currently no new guidelines in the process, but it's still applicable, even though it's quite an old guideline. So generally, if a patient has symptomatic treatment is still an integral part of the management of children or even adult with sore throat, which include the use of make sure patient have adequate fluid intake, anti-analgesic, antipyretics, paracetamol. Patient very quite big pain, then we may give some NSAIDs and some throat lozenges and gargles or sprays and other DEXA. It depends. I don't usually give DEXA. Okay, but in some condition, very big swelling of the throat, it may give a short-term steroid to reduce the swelling. Antibiotic therapy is only indicated in bacterial infection. So how can you confirm? You need a rapid test or a throat swab, or based on the modified Centaur scoring. Then it should not be used routinely to treat all patients come to you sore throat. Okay, objective, why we need to treat the group S strep, pharyngitis, because we want to prevent the complication, as explained before. We want to prevent the peritonsil abscess, the rheumatic fever, and also want to shorten the clinical course of the infection. Penicillin is still the main choice for group S strep because of a proven efficacy, narrow spectrum, and safety, and it's not expensive. Usually 7 to 10 days course is adequate. And if patient is allergic to penicillin, we can consider erythromycin or clindamycin. This is from a modified Centaur score, where we ask patient whether if the cough is absent, then got 1 mark, because the cough absent, then it may suggest a bacterial infection. If cough present, the likelihood of virus infection is higher. If the anterior part of the zygomatic lymph is swollen and tender, then 1 mark, because it's more likely to be bacteria. Temperature more than 38 degrees, 1 point. Tonsillar exudate at the surface, whitish exudates, 1 point. And if it's 3 to 14 years old, 1 point. If it's more than 45 years old, -1, because it's less likely. Okay. If 15 to 44 is 0. So less than 3 points is low risk, do not require antibiotic. More than 3 points or more are high risk, then you may need antibiotic. This further is almost the same. It's a modified Centaur, or we call it MAC-Isaac score. Why do we need to classify it? Because the risk of the likelihood of the streptococcus infection. Okay, this is without testing. If it's score 0, the likelihood very low. If it's 3 or more, the likelihood is even higher. So if it's 3 or more, then we need to treat. Either we treat after we do a rapid test. If it's positive, we treat, or we can treat empirically. If it's score 4, then we need to, because the likelihood is quite high, 50%, then you can treat the sore throat with antibiotic prophylactically. There's many other criteria, different country or different symptoms, they may use other criteria. For example, in this one, in the UK, they use fever pain scoring. Actually, the criteria is almost the same, just probably not as much as the modified Centaur. Temperature, exudates, tonsils, and absence of cough. And also, it just to certify the risk of the strep infection, whether you need to start antibiotic or not. In our Malaysian National Antimicrobial Guideline 2019, it is stated that if for tonsillitis and pharyngitis, and if you think that it could be group S strep, the first line treatment is still a penicillin V, or you can give other penicillin groups such as amoxicillin. If patient is allergic to penicillin, you can give erythromycin. If it's an abscess, we need to drain the abscess, but also we need to start with antibiotic. But we need a broader spectrum because they may higher risk of anaerobic infection. So we need ampicillin with sulbactam, amoxicillin with clavulanic acid, or you can give penicillin with metronidazole to cover a wider spectrum, especially anaerobic organism. In pediatric, if tonsillitis, the first line is same, penicillin or amoxicillin. If it's allergic to penicillin, you can consider cephalexin or erythromycin. The course is usually for 7 to 10 days. So when antibiotic should be avoided, if you suspect patient may have infectious mononucleosis, which is an EBV infection. It's a virus infection. Patient comes to you with all the viral prodrome, fever, sore throat. When you look in the throat, there's a whitish patch. It may be diphtheria, but this one is not diphtheria. It's an EBV. And when you scrape, it's easily scraped off. As compared to diphtheria, it can cause bleeding. So in this kind of patient, why you shouldn't give? Because when you give penicillin-based antibiotics such as amoxicillin and ampicillin, patient will develop rashes over the face and also the trunk and extremities. And this maculopapular rash is quite itchy. Accompanied with the patient can even develop splenomegaly. So how to confirm? You can do a serum, a simple full blood count. You can see lymphocyte count is high because of virus infection. Monospot test is a diagnostic test. You can see the EBV IgM and also the EBV DNA if you have the accessibility to this kind of test. Then we come to the surgical treatment. So a lot of people say if you have tonsillitis, then better to have tonsil removed, but it's not always indicated. So we have very strict criteria when it comes to whether we need to remove the tonsil, because the surgery is not without complication. Okay, so the guideline we take is from, if you follow, is from American Academy of Otorhinolaryngology and Head and Neck Surgery. Patient needs to have recurrent episode of tonsillitis more than 7 episodes in a year, 5 episodes in 2 consecutive years, or 3 episodes in 3 consecutive years. And that each episode must be confirmed. Either is by history, patient has significant fever, enlarged nodes, exudus of the tonsil, or is confirmed by documentation. Is proven to be a tonsillitis. Okay. If it's peritonsillar abscess, patient a history in children, patient 1 episode of peritonsillar abscess is indicated to remove the tonsil. But in adult, it needs at least 2 episodes. Or all these tonsillitis causing problems such as febrile seizures, or the tonsil is too large that it causes problem with the airway obstruction, patient cannot swallow properly, interfere with the speech, cause some other problem, then we may consider to remove the tonsil. Or if adult, you think one tonsil is very big, you suspect that this could be something sinister such as cancer, you need to remove the tonsil so that you can send to the lab to see under microscope whether it's a cancerous cells within the tonsil. So tonsillectomy is quite a straightforward and simple procedure, but it has to be done under general anesthesia. We open mouth with the mouth guard, then you can see the tonsil. Then we can remove with some methods so that it tend to bleed. Usually, when it tend to bleed from tonsillar bed, we need to secure the bleeding. Usually, use a cautery to stop the bleeding vessels. But this, what you see after operation, because of the cauterized effect, the tissue will appear whitish and sloughy, and it could be quite painful after operation. So, patient, the slough initially may build up. Then patient at this point in time can give some symptomatic relief, gargle or spray, okay? And at the same time, a systemic oral medication to reduce the pain. Then once patient start to eat, chew, get better, you can see the slough will be removed and the wound bed will be healed nicely. For peritonsillar abscess, it need to be drained. So we can just simple do under local anesthesia. You need to cut over the abscess and drain the pus. Then patient continue with antibiotic. So we come to the cardinal signs of inflammation. There are 5 cardinal signs. We call it in Latin, we call it calor, rubor, tumor, dolor, and functionalesa. So calor because of the heat, because of the, you can feel the surface is warm because of the vasodilation. The blood vessels circulation is more in the area, you feel warm. And it appears red because of the increased blood in that area. Swelling because of the increased vascular permeability, the fluid is escaping from the vessel in the surrounding tissue. And it's pain because of all the cytokines or the inflammatory mediators, especially prostaglandin, it causes a lot of pain. Loss of function will occur in certain parts, such as the joints. So these are 3 cardinal signs: the heat, color, rubor, tumor, the swelling, the pain, dolor, and loss of function. Benzidamine hydrochloride has triple A function, which has anti-inflammatory, analgesic effect, and local anesthetic effect. Its main anti-inflammatory activity results from inhibition of production of pro-inflammatory cytokines, mainly the tumor necrosis factor alpha and interleukin-1 beta, which all these two, the tumor necrosis alpha and the interleukin beta, is a pro-inflammatory cytokines. Then this benzidamine inhibit this pro-inflammatory cytokines, so the inflammation wouldn't be as bad. Okay, or it can stabilize the cell membrane so that there is less vasodilation and less increased vascular permeability and less swelling. And through the stabilize the cell wall, so reduce the inflammatory substance that passing through the cell wall. So these are the main mode of action by reducing the inflammation by the benzidamine. So it's an ideal topical application in the management of pharyngitis and tonsillitis. It can be in the form of a gargle, a spray, or lozenges. It has specific concentration and on the surface, and it has analgesic activity in this inflamed tissue. Because of the vasodilation, it stabilizes it. It reduces the neutrophil aggregations in the surrounding tissue, the inflamed tissue. It inhibit production of pain and inflammatory mediators such as tumor necrosis factor alpha, prostaglandin, and it increase or inhibit the vascular permeability. It makes the vessels less leaky so that there is less edema and erythema. But if you use it on normal tissue, there's no effect. I mean, it can be safely used. Okay, if it's in the surrounding tissue is normal, it won't cause any effect in the normal tissue. So it's a study, recent study, March this year, where they compare the evaluation of the onset of action of benzidamine spray and the lozenges in patients presented with acute sore throat. So they collected, it's a multi-center open label clinical trial in the 12 centers in European countries, where they collected 363 subjects with recent onset of sore throat, which has been diagnosed as tonsillitis or pharyngitis. So they have 2 groups. One is according to their protocol, they test on the effect of these lozenges and the spray at immediately after they give. Then a few minutes after that, they ask the patient about the symptom really reduced or not. So one group they're following protocol, another group is intent to treat, where they doesn't really follow the protocol. But whatever the result shows that actually is a significant reduce in the sore throat relief rating scale by patient. So effect come as early as 2 minutes after they're given these topical medications. And the effect can be quite last. So it's effective, both are effective. The spray and lozenges are effective in providing the pain relief as early as 2 minutes after single administration. And the effect can last up to 4 hours. And the sensation, patients say that the sensation of swollen throat are reduced by treatment with benzidamine within 120 minutes. And this anesthetic and analgesic properties of benzidamine spray and lozenges can be effectively addressed the patient prior to rapid onset. And the clinical efficacy after 7 days of treatment, and the drug have a good safety profile that is observed within the study. So this comes to my last slide. So the take-home message is sore throat is a common presenting symptom to primary care or even to you, to the community pharmacist. Patient may come with wide variety of causes, but not all sore throat will require antibiotic treatment. And the most concerning us is whether it is a group A beta hemolytic streptococcus infection, which can cause complication, peritonsillar abscess, rheumatic fever, glomerulonephritis. And empirical antibiotic use should be limited to patients who are ill, high risk of complication, and show no sign of improvement after 5 days. If you are not sure, refer to a doctor, we can check further. And if you see a patient with oral ulcer, recurrent oral ulcer, or oral ulcer that's persistent more than 2 weeks, doesn't heal with topical treatment, please refer for further investigation. And topical agents, benzidamine is proven to be useful for symptomatic relief, well tolerable with minimal side effects. With that, I thank you very much, and I open for any question.
Thank you, Doctor, for your interesting and also very informative sharing for the past 45 minutes. So now we open for Q&A session. So participants, you feel free to type at the question part and we'll choose the question from there and Doctor will answer it accordingly. So Doctor, as a pharmacist, I think we face a lot of sore throat cases, right? So in your opinion, so what factors actually affect you the most when you're selecting a sore throat medication for your patient? So you choose a fast onset or choose based on like taste or convenience, or what's your opinion, Doctor?
Yeah, thank you for the question. And most commonly, if I see, I'll divide it whether a patient is inpatient or outpatient. If I see patient is after operation, immediately after operation, then I'll need a very effective medication, then so that the pain can be reduced or inflammation can be reduced. Fast onset, what I mean. So usually I give, depending on the location, if it's in the oral cavity at the tongue, I will give gargle. Gargle, you can gargle as frequent as 3 to 4 hours, even less 2 to 3 hours also can. And if it's deeper in the throat, the tonsil, posterior pharyngeal wall, or even down in the pharynx, then I tend to give spray, because the spray can reach further down in the throat. And if it's younger children, less than 12 years old, but they cannot gargle that well, they are not good in doing gargle to reach the throat, then I tend to give them throat spray. But all this mentioned, if they understand the instruction, then I may give gargle. Yep.
Okay, thank you, Doctor. So there's another question in the Q&A chat box there. So what's your opinion on the antibacterial activities in benzidamine?
Oh, okay.
I think you mentioned in your slide as well, right?
Yeah, thank you. Yeah, the main antibacterial action is not really like an antibiotic kind of action. It doesn't kill the bacteria. It's more to antiseptic property. Antiseptic means it only cause we call it bacteriostatic. It reduces the bacterial activity, but it may not kill the bacteria. Okay, so if there is just a low bacterial load, it may be effective. It can reduce the inflammation, can prevent further bacterial infection. But if the bacterial infection already sets in, such as group A strep, then we need antibiotic treatment. Yeah.
Okay, thank you, Doctor. So there's another question. So for your pediatric patients, right? Let's say a small baby, if they have any symptoms like you have mentioned just now, that will you consider to use benzidamine? If yes, like what are the common challenges that you're dealing when choosing a medication for a small baby or even very small children like 4 years old, 5 years old?
If I'm not mistaken, the indication at the moment for benzidamine is 6 years and above, correct?
Yeah.
Yeah, 6 years above. So the reason they don't recommend in younger children just because we don't have the data. I mean, there's no clinical trial running on these children because it's not easy to run clinical trial on children. You need the process or the protocol could be quite complicated. You need consent from parents or that. But so far that when you use, let's say 6 years old, we use benzidamine 6 years old, we actually don't see much of the side effects. Actually, it's quite well tolerated. I don't really use in infants, small baby, yeah. So I cannot really comment whether it's useful.
Okay, thank you, Doctor. So the next question will be, could the consumption of probiotic affect the effectiveness of benzidamine?
The
probiotics, yeah.
Oh, okay. You mean you take benzidamine and sometimes take probiotic?
Yes.
Oral kind of probiotic. So yeah. I don't think there would be effect. because the oral, when you take oral, you swallow, is more to the systemic effect that it digests and go to the bloodstream or that. And benzidamine is really more to topical or local effect, local analgesic, anti-inflammatory effects. So I don't see any contraindication when you, let's say, you take probiotic at the same time you take benzidamine. Yeah.
Okay, understood on it. I think we met some of patients that have frequent recurrent mouth ulcer. Maybe they are using certain medication like a mouth steroids or those ulcer medication in the market. But after a cure, it will come back after some time. So what is your suggestion in such case?
Yeah, you need to find the etiology lah. If it is a simple or not so complicated after ulcer, actually you can add on more few medication that are different mode of action. Like in the benzidamine is good for analgesic, local analgesic, some anti-inflammatory effect, and in some other, sometimes I combine some other product that can act as a barrier. That can apply the ulcer site. Then it can act as a barrier so that whatever saliva, the food has less contact on the ulcer, and it can reduce the pain as well. But the point is, if patient have recurrent ulcer, come to you like every few weeks, come to you the ulcer the same side or different side, please to refer to a doctor so that you can have proper checkup to rule out anything that is not. Sometimes it can be underlying manifestation of some systemic disease, such as SLE or some autoimmune disorder. So we need to investigate. Yeah.
Yeah, I think it's very important for us to help the customer to rule out the underlying problem. Then we can do the referral to the correct doctor as well, right?
Yeah,
But
correct.
sometimes maybe sometimes the patient they will ask like, I'm going to see a doctor. So like maybe you can advise them that what kind of test that doctor gonna do so that we let the customer to know what the timelines. Maybe they expect, oh, I go to see doctor, I get the answer immediately.
Okay, and actually not easy. If it's, let's say, it depends on how severe the symptom is. If it's getting very frequent, then we really need to refer to a doctor to check. If we go to a general practitioner, they can easily do a blood test. The blood test, including all those autoimmune screening to rule out any other autoimmune disease such as SLE. If they need further investigation, then they will refer to other subspecialty. For example, if they really think of something ulcer deeper, or they think of some tongue cancer, for example, they'll refer to ENT or oromaxillofacial surgeon to have a further look. Then we need to really assess properly, not on the oral cavity alone, need to assess the throat lower down, and we may need to take a biopsy, a sample, cut a small piece of sample from the ulcer and send to the lab. Or if it suspects some autoimmune, they refer to the rheumatologist to do further blood test to confirm that.
Yeah, thank you, doctor. So I think it's really important for us to guide the customer to the right doctor to do certain tests, because it might not be a very easy, just one go answer for them, right?
Sometimes they may be afraid that we don't know what to do, but just reassure them that we won't do everything on them. We look at their history, their examination, then tailor to that, see which are our suspicions. Then we don't do like whole sets of everything in one patient.
Yeah.
Based on our suspicion, then we tailor our investigation to that condition.
Yeah, I think it's also our role to assure them on such processes.
Yeah.
For the next question, doctor, do you use benzidamine on pregnant women or breastfeeding women, or what's your opinion?
Okay. At the moment, and I don't see that much of pregnant women and breastfeeding women because I'm practice more in ENT. But in the drug leaflet or information, there's no safety data on pregnant woman or lactating female. That means the safety data is not there. So I cannot really recommend you to use it. But I can tell that the medication is more to local effect, and even used in normal adult, we don't see any serious adverse reaction. But because of the pregnancy, we don't want any effect to the baby, usually commonly in the third trimester. So I don't advise it to be used in a pregnant lady or lactating mother. So in some cases, that if let's say patient insists, I want to use, okay, we cannot stop them. So right. So but if you need to really advise them to use a short term, I mean 3 days, 5 days, then once the symptom resolve, you should stop it. You say, how if my symptom lasts more than 7 days, I still need to use it, then it's not a simple viral infection anymore. So you don't use it, you need to further investigate what are the costs of the sore throat. Okay.
Yeah, I agree. If the medication doesn't really help the patient for more than 7 days, I think we should investigate other causes, right?
Yeah, correct.
Okay. So, doctor, did you normally give papain or serapeptidase to sore throat patient in addition to the other medication that you have mentioned?
Actually, no, I don't give. I don't give papain to sore throat patient because it was a papain is actually a anti-inflammatory drug also. But I don't see any difference if I give papain and NSAIDs. If it's really bad, usually I give NSAIDs rather than papain. Yeah.
Yeah. Okay. So if a patient is having a sore throat now, so would you counsel them or restrict them on any specific food?
Oh, okay. If depends on the condition itself. For example, in patient immediate post tonsillectomy, they just have a tonsil removed because of the wound at the tonsillar bed. It can be very painful. So initially, we will ask them to take something that's easy to swallow, a soft diet. For example, a porridge that is not too hot. And the patient can even take something cold that is soothing the throat. And for example, the ice cream or some jelly kind of thing, especially in children, they can take that so that it doesn't cause pain at the back of tonsil. And patient need to drink a lot of water. Actually the same thing applies to other kind of sore throat, like patient having acute tonsillitis when they have acute inflammation in the throat. If you ask them to take something very dry, very hard, it causes more pain because of the friction of the food to the throat, to the mucosa. So you can ask them to take something easy to swallow, the softer diet, porridge or something, or if they want to take rice, they need to have more soup to eat so that it makes them easy to swallow, and not too hard like biscuits or that the hard one like those with like ikan bilis, or those try to avoid because it's sharp and hard, it causes more pain.
Okay, so for sore throat cases, really prefer customer to take some of the soft food to reduce the friction between the food and the throat, right?
Our aim is make sure they have adequate nutrition actually, because when they have sore throat, especially in children, they'll tend not to eat because sometimes even when they swallow saliva, they take any kind of food, they cause them pain. So they just decided I don't want to take anything, but they are at risk of dehydration, so it's not good. Yeah.
Okay. So the next question will be, doctor, do you prefer or recommend to use benzidamine lozenges with throat spray at the same time, or maybe gargle? Yeah, what is your recommendation in using more than one benzidamine ingredient?
Oh, okay. Actually, I do that. I do that. Sometimes I give patient lozenges as well. I give patient gargle because it depends on where or when the patient easy to use that. Just especially when patient having what needs to go out, for example, they cannot carry the gargle all the way. It's difficult for them to gargle any place, and they need to spit out the gargle. It's not easy. So it's good when they can carry on some lozenges or some throat spray, so that whenever they feel the pain, they can spray or take some lozenges. So actually, I don't see any adverse reaction so far that I combine lozenges or combine with gargle. Yeah.
Okay, thank you, doctor. So maybe we take another 2 to 3 questions for your session. Okay, if the patient is having a sore throat with a hoarse voice, it means that no sound already there, or they can speak properly. So what is the advice or any medication that actually can improve the voice?
Okay, this one I didn't include, but if very good question, thank you. Because if patient come to you a hoarseness or the hoarse voice, and usually it's caused by a virus infection, but virus infection is self-limiting. It should resolve. The most is like 10 to 14 days. The symptoms should go away. Okay, if it doesn't go away, that means the pain become more and more, the fever become more and more high-grade persistent. You should think of bacterial infection. We call it supraglottitis. Inflammation in the throat, the epiglottis, the throat, they become more, and it's getting worse, especially in children. It can obstruct the airway. Patient can be noisy breathing, a stridor, like asthmatic breathing, but it's not asthma because it's blocking the airway. Then patient need to come to hospital to treat the inflammation. Or in other thing, patient, if the hoarseness is there, patient just hoarse voice, no signs of infection. Patient say, oh, no, just hoarse voice, no pain, I can swallow well, no fever. Then you should think of cancer at the larynx. laryngeal cancer or cancer of the voice box at the vocal cords. That hoarseness that persists more than 1 month, that doesn't resolve with any medication, especially male, smoker, more than 50 years old, please refer to ENT for further check. You can just scope and you can see any problem in the vocal cord.
Yeah, I think one of the factors that affecting the smokers are the ulcer or the cancer, right?
Correct.
Okay. Thank you, doctor. So maybe our last question for doctor today. So diabetes patient tends to get a lot of mouth ulcer. So what's your advice or comment on this?
Okay, because if diabetes, usually those with uncontrolled diabetes or chronic or long-standing diabetes, they have some sort of immunodeficient. They are immunodeficient because of white cell chemotaxis, or they are deficient. So also if they are not, especially more so if their sugar is not well controlled, so they can tend to get all this virus infection because of immunodeficient, and on top of that, they tend to get abscess, like infection, tonsil from a simple tonsillitis, bacterial infection, they develop into a lymph node, the lymph node separate, they become an abscess, become a neck abscess. Then usually in our ENT, we see quite common, and we can see it's seasonal. Usually after some big celebration, they eat a lot, then the sugar become haywire, then they tend to develop this neck complication.
Okay. Thank you, doctor, for your very interesting, I think it's also many very impactful training for us, because I think the Q&A question is also very relevant to our daily practice, that we see a lot of patients also with such concern or also issue with their sore throat related problem. Okay.
Thank you very much. Thank you so much.
Yeah,
Thank you everyone for the question. Yeah.
Okay, so for everyone, so now we will launch a poll sessions. We have 3 polls for today to see your understanding on Dr. Lam's topic as well. Okay, so we have 3 polls that each poll will last for 30 seconds that you can answer it accordingly. So one moment. So we will launch our first poll for today. Okay, so these are also actually included in Dr. Lam's slide just now. So which of the following is not one of the cardinal signs of inflammation? Okay, and doctor, there's one slide that you mentioned what are a few cardinal signs of the inflammation, right? So what are
there
them?
are 5 cardinal signs, correct?
Yeah, okay. So what are them? Which of the following is not one of the cardinal signs of the inflammation? Okay, we will have another 30 seconds for the answer, then doctor will explain it later. So repeat the question, which of the following is not one of the cardinal signs of inflammation? Weakness, which is rubor, heat, color, swelling, tumor, numbness, anesthesia. Okay, we will have another 10 seconds. So after that, we will end the poll and also show the answer, and doctor will, explain on the answer. Okay, so that's all for our first poll for today. So let you can share the result. So okay, doctor, you can see the result, right?
Yeah, I can. Yeah,
okay.
Correct. Numbness. The rubor is because of the redness, because of dilated vessels, then have increased temperature, that cause color, swelling because of the fluid exited from the blood vessels, they cause swelling, and numbness not really. Actually, it has increased pain because of the cytokines, prostaglandins effect. Yeah,
the missing one is pain, but not the numbness. So let us go to the second poll. All right. So what is the mechanism of action through which benzidamine hydrochloride reduce inflammation? So like say how benzidamine can reduce the inflammation, right? So there are few mechanisms in the following choices. So which of them is correct? A, blocking voltage-gated sodium channel. So is it a sodium channel blocker? B, inhibition of tumor necrosis factor alpha and interleukin. I think doctor actually mentioned it quite obvious just now. Okay. C, increasing pro-inflammatory cytokines. This is the answer. Or the last one will be enhancing the COX-2 activity. Yeah, so we look at how doctor give tips just now. So we have another 15 seconds for this question. What is the mechanism of action through which benzidamine hydrochloride reduces inflammation? A is about sodium channel, B will be about TNF alpha, C pro-inflammatory cytokines will be about COX-2 activity. Okay, so these are the choices by our participants. So, doctor?
Yeah, majority get it correct. Inhibit the tumor necrosis factor alpha and interleukin-1 beta. These two are actually pro-inflammatory mediators. They are cytokines that aggravate the inflammation. So if you want something to be anti-inflammation, then you can have something to have increased pro-inflammatory cytokines. So that is not correct. And enhancing COX-2 also incorrect. Like some NSAIDs are COX-2 inhibitor. So the answer is B.
Yeah, methylamine doesn't act like COX-2 inhibitors. So the last question for Dr. Lam side. Which of the following is not mentioned as part of the sore throat management option? Okay, so we have symptomatic treatment, we have surgical treatment, we have antibiotic therapy for all sore throats, antibiotic therapy for GAB, HS, pharyngitis. I think this is a very obvious answer that
I hope everyone get it right because I stressed many times.
But maybe I'm questioning a bit tricky because which of the following is not, if you want to answer it very fast, right, you might click it wrongly that you answer as a yes. Our question quite tricky as well. Okay, for sore throat cases, so which of the following method is not going to be used or recommended? The first one, symptomatic treatment. The second one, surgical treatment. The third one, antibiotic therapy for all sore throat cases, or antibiotic therapy only for GAB, which is pharyngitis. So I think most of them got this quite well. So we share the result for this question. Okay, doctor.
Okay. Not all. Okay. All right. Okay. And we don't give antibiotic to all sore throat cases because majority actually are still virus infection. So when you suspect, only when you suspect it's a bacterial infection, especially group A beta hemolytic strep, such as, then you give antibiotic. Okay. Surgical treatment also limited for some indication, recurrent tonsillitis or those kind of thing. So it's not a primary treatment for acute infection. Yeah. But I'm happy the symptomatic treatment got no answer symptomatic treatment. Yeah.
That's one of the mainstay of the treatment, right?
Yeah.
Okay, so really appreciate Dr. Lam to spend your time over here.
Thank you. I enjoy the session very well. Yeah.
Okay, so if anyone have any question, then feel free to leave in the comment section. Maybe the SwipeRx team will look at it later. All right, so thank you, Dr. Lam. Really appreciate to spend your time over here with all our participants. Thank you so much, and hope to see you again in our maybe next webinar on this.
Sure. Thank you very much.
Okay, thank you so much. So next, we will go to the part 2 of today's session. All right. So part 2 will be in charge by me. So my name is Wenkit. I'll introduce myself again. And today I would slightly expand from doctor presentation just now that we're going to a painful mouth condition that doctor has mentioned by using from a pharmacist perspective, or we would say as a pharmacist guide. Okay, so because we have very common we see cases in our community pharmacy, then we can see what we can do for the customers. Okay, so these are the disclaimer for today's session. So how often did every one of you, encounter cases of sore throats actually? Okay, so actually you all can do a reactions at your, some of them are doing reaction already. Okay, you all can actually do some reaction to this Zoom website. So how frequent you encounter cases of sore throat actually? So we can see you have, every day you clap, once every day you give thumbs up, once a week you give wow, once a month you can give a love shape. I think I can see many claps floating here and there, right? So I think most of us, if from a community setting, we will see soft cases almost every day. Okay, it's very common. Okay, thank you for all the claps and love as well. All right. So next, on average, actually, an adult will experience 2 to 3 sore throats each year is very common in whole world. Like me, because we talk a lot with the patient that actually we've got sore throat, I think 2 to 3 times per month, which is actually quite frequent. Maybe some of you also have the same issue as us. So, and how many types of medication do you offer to your patients? Do you just give one medication or do you give more than that? Two medication, three medication of different formulation? So how you, as a pharmacist, how do you advise your patient? So we have a scenario here. Okay, this is called scenario one. So a customer come in, hi pharmacist, or they are looking for your, talk to your staff. Hi, can I have a pack of lozenges? So very common that we ourselves or our normal staff like pharmacy assistant or health advisor, they will ask, oh, what flavor do you prefer? Orange, okay, I want orange flavor. Okay, thank you, one packet. Then they can do the cashiering and bye-bye. Okay, so I think this is a more like a convenience store, but not from a pharmacist perspective. Because we can do many things for our patients. I can examine them, we can give them counseling. It's more than that, just a one pack of lozenges. Okay, so this will through this half an hour session, we'll focus more on this, how a pharmacist should react or we can react to help our customers. So what is sore throat actually? So sore throat is a pain, scratchiness, or irritation of the throat that often worsen when you swallow. I think doctor mentioned it many times as well. And also repeated many times that actually viral pathogens are the most frequent causes of infective sore throat compared to bacterial pathogens. While group A, the GABHS, is the most common for acute pharyngitis only. Okay, most common is caused by rhinovirus. I think account for more than 1/5 of all the sore throat cases. And we have viruses, bacteria, and fungal. But not so common, I think we see most are from virus group. Strep throat is something that very serious for us, we need some time or we need some antibiotics to treat. But actually, it's not really something that really can do directly because we don't prescribe antibiotics. It should be under a doctor examination. But actually, there are many things. We see a customer walk in from a community pharmacy, then ask for, hey, I want amoxicillin. Can you prescribe to me? So many of us will say, oh no, we don't sell antibiotics. Instead of rejecting the customer directly, from a community pharmacist perspective, we should actually help the customer to understand their condition first before we just reject them directly saying, oh no, we don't sell antibiotics. Okay. So examine the patient, we help the patient with condition. And some of the time, they actually don't need antibiotics, and we should counsel them on this antibiotics necessity for sore throat cases as well. So I think we also stand a very important role in doing all the counseling role. Other causes of sore throat, yeah, this is how we should identify what causes their sore throat instead of just saying no directly. Maybe they have allergic issue, maybe they have a post-nasal drip. I think this is like super common. Some irritants, or maybe they have a muscle strain like yelling, talking loudly, or presenting for a long period of time without any rest. Sometimes they have hoarse voice because they have a gut issue, they may exacerbate their sore throat problem. HIV infection, tumors like what Doctor mentioned just now, and one more very important but often we neglect is from the medication. Some of the medication that will cause agranulocytosis, which will cause a sore throat or accompanied by fever, ulceration, and rash at the same time. So these are the list of medication that will cause. So I think it's very common. You can see carbimazole, colchicine, or those chronic medication that taken every day like spironolactone or sodium valproate. These are the medicine that mentioned by doctor just now. And we aim very a lot on this symptomatic treatment because that's our main role in as a community pharmacist. So for half of this session, I will focus a lot on this MAC-Isaac scoring system. And I hope every one of you actually can somehow memorize it. Actually, it's not too difficult. It's very easy. And there's only 5 main criteria for us to use for this MAC-Isaac scoring system. MOH actually recommended clinician decision for sore throat management based on this MAC-Isaac scoring system. Because actually, like mentioned by doctor, there are many different criteria, right? So I choose this as my own practice because it's very easy, very easy to remember, easy to practice. So we look at temperature. Is it because I think we have a thermometer in our pharmacy, right? During COVID time, I think every one of us ready a thermometer over there. We scan over the patient feet, then we can see what are the temperature for the patient. Next, we ask the patient, do you have any cough? Like doctor mentioned just now, if patient has coughing all the time, so more likely, okay, so it's a virus infection. Okay, so if no cough, then will be a bacterial infection. So next, the tender anterior cervical node. Later, I will show you all the pictures. Ask them, examine them, do you have tonsillar swelling or exudates, and ask the patient on the age as well. It's more common on the children's side actually. So look at it, my access scoring. So after you ask the patient's questions, okay, then you get the total score from 0 to 5. Then you can, in your mind, you know, okay, if patient has 0 score, so it's very unlikely to, then for them to have a bacterial infection. They don't need antibiotics, and we don't need a culture for that also. So we can treat them by giving us some symptomatic relief, or we can assure them they just need to rest well, or any immune booster that we can pass to the patient as well. If patient is having a score of 2 to 3, then we can prescribe them some symptomatic treatment for the patient and tell them if it really doesn't work for you in after 5 days or 3 days, then they should be referred to a doctor. Maybe they need antibiotics for this case. If you get a very serious, a very high scoring of MAC scoring, so we need to refer to a doctor to treat with antibiotics empirically. The best if the clinic has also some tests like Dr. mentioned just now. So where are the anterior cervical nodes? Okay, so actually I think you all can look at me with a photo, right? Then you can also touch over this side. Okay, from this picture, you can see the dotted line, right? So actually the anterior cervical nodes are located in between these two dotted lines. So it's over here. Okay, from this slide, actually you can appreciate that actually we can help the customer to identify whether they have this anterior cervical nodes. Because after then, do you know about this node? Then of course they say, what is that like that? Okay, but instead of that, actually, we can help the exam patient, ask their permission. You can wear a glove or we can just touch with bare hands. Okay, so we can examine here. Is there any tender feeling that you can get from this cervical nodes area? The next one, we examine them. So I think it's very common, very easy. We have a torchlight, right? So we can use my phone to open a torchlight to examine the throat of the patient. Actually, we are very frequent that we do this. Actually, this is not only for you to identify whether they should need antibiotics or which treatment you should give. Instead of that, we also can show them that we do have extra service for them. Okay, I think this is one of the important points that I'm willing to bring out. Is there any tonsillar swelling or you just exudates like some simple white patches or the lining like that? So how to do a throat examination? Basically, you need to ask the patient to open his or her mouth first. Okay. Then you can use a tongue depressor. I think pharmacy, you cannot see my picture. Okay, this is a tongue depressor. I think it's very common for pharmacy to sell this. And we actually can help to press down the tongue because maybe we can't really see clearly. Then we can use the use of tongue depressor as well. So ask the patient to say, okay, then we examine them by the torchlight and also the tongue depressor. So we can inspect the pharynx, overline, and tonsil area to see is there any swelling, is there any uncommon sign that you examine, is like really swollen, okay? Then we evaluate whether you have symmetry, whether you have exudate, enlargement, or different color with that, okay? Then you can repeat on that. Then remember, we should directly dispose the tongue depressor. The best, you can spray with alcohol, okay? We can do more just instead of just asking the patient to leave because we don't have antibiotics. Yeah. So this is how me as a community pharmacist can practice to use this method to examine the throat and provide some counseling or medication for the patient. So throat examination, I think very common. I think myself is blocking way. Okay. So as healthy throat, you don't see anything. For its laryngitis or pharyngitis, you can see our side or internal side of the throat has a little bit of swollen. Tonsillitis from the side of the tonsil. Tonsillitis is the infection of tonsil, right? So the tonsil is a bit swollen and also enlarged actually. So diphtheria, I think doctor mentioned just now also, is a very actually should be avoidable problem in our community, but it happens sometimes. If you identify this, we should do referral immediately. So the not so common one is a fungal infection on the tongue. Might be a side effect of the chemotherapy or immunosuppressant. So let's go our sore throat cases for today. The first one. So Ali, a customer coming to you, 13 years old, 60 kg, tell you that he has a sore throat started 2 days ago. Pain at all the time, even without swallowing, appear tired. Okay. Patient start to have runny nose started yesterday, feeling heaty, no other symptoms. Upon checking, the temperature is 37.3 degrees Celsius. When I touch the notes, okay, the cervical nodes there is not tended, okay. So what is our throat examination? From this picture, you can see, okay, I think, am I blocking the picture? Okay, so from this picture, you can see, okay, maybe a bit of swollen at the tonsil side. You ask further, no allergics. So what medication has patient tried? he tried paracetamol, 500 mg QID yesterday, but not effective. The medical condition is generally healthy, having exam recently. Okay, so let's do our first test today. Okay, for this criteria access scoring, from this case, patient having such temperature, such symptoms, the cervical nose condition, and when you examine the throat and the patient age. So from here, what is the access scoring for this patient? So I think you all can also use the emoji. Okay. Yeah, I can see some emoji floating already. Okay. So if you think it's access scoring is 0, then you put like glad. 1, you put thumbs up. 2, you put cry. 3, you put wow. 4, you put love. 5, you put celebrate. So I think I see a lot of crying faces and wow faces over there. A little bit of thumbs up. Okay. We see a lot of emoji here. Okay, so let's see. Okay. Yeah. Sorry, I'm self-blocking the answer again. Okay. So temperature more than 38, no, the patient is not fever, but maybe we should think that this fever condition, because patient took paracetamol 500 mg QID yesterday. Maybe this is one of the reason that patient don't have any fever, but actually there's underlying fever. But for this case, actually it's no. Patient has no cough, tender and cervical node, not really. Tonsillet swelling, and the age is 0 to 14. So actually, there are 3 scores for this patient. Okay, I think this is one very confusing part is that on the cough part. Okay, again, I would like to emphasize that if you have no cough, then you get 1 point. Okay, got. If your patient has cough, this 0 point, is not negative point. Okay, negative point only apply for age 45 and older. Okay, I hope this gives you some understanding. Okay, so the answer is actually 3. Wow. Okay, they got a 3 score for this. Okay, so what are the treatment available in our market or in our for community pharmacy? So we give from this guide, then we give a symptomatic treatment, right? So it's very important. Emphasize again. Symptomatic treatment should be always the first line that we should most of the cases. Okay, so the treatments available in the market, they are systemic analgesic or NSAIDs. So like paracetamol, ibuprofen, then we need to calculate the dose for the patient. Okay, but we don't use aspirin. Aspirin insurance, we don't use. The second option is steroid, but steroid again is a group B medication. So the third one is topical analgesics or anti-inflammatory lozenges or spray. The fourth one is topical antiseptic. The fifth one is antibiotics. These are the common medication that we use. And here I would like to recommend something that Dr. mentioned just now as well, is benzidamine. Because benzidamine, one ingredient itself is already covered 3 types of main mechanism of action, which is a triple A. Okay, you remember benzidamine, then remember triple A. So we have the anti-inflammatory action, analgesic properties, and also analgesic anesthetic effect, means they give a slight numbing effect, or locally only, not the whole body, but only on the affected region, based on the mechanism of action of medication. So this special local anesthetic activity of benzidamine is because they have this structure. So we do look at these benzidamine properties. Actually, they are very similar to other local anesthetics. Okay, they reversibility block nerve conduction occurs when applied topically. Okay, you can see that the structures are very similar. That's why they have these special properties. On not just only like NSAID, only painkiller, right? They don't give numbing, but benzidamine, they do give numbing effect because of their structure. So benzidamine versus other NSAID, like the base is actually non-acidic for benzidamine, so it's gastric friendly. Okay, you won't actually get any gastric problem in a low dose, while NSAID might give you some ulcer problem. They also have membrane stabilizing effect, giving the anti-inflammatory properties, anti-anesthetic as well. And the one very good thing about benzidamine is on the poor protein binding, which means that you actually need a very low dose of medication to get very good effect because it's highly free drug, unlike NSAID. The next one also mentioned by doctor is at the same slide from recommendation of CBG 20 years ago, but they're still very relevant until the today practice. Okay, so I wanted to present a few more studies about the benzidamine. This is double-blind study for treatment of sore throat many years ago, but very relevant. There are 44 patients with sore throat. Okay, then they give the benzidamine solution. Okay, so they gargle it. It's a Difflam gargle. So gargle 15 ml of the test solution and repeat every 2 to 3 hours for 1 day. Means that you almost use 1 to 2 bottles per day. No other analgesic or anesthetic agent actually, and give the placebo solution for the other group. And the physician will examine the flaring condition for hyperemia or edema, or the patient will report on the symptomatic relief of pain and dysphagia. So for this diagram, I think it's very obvious that we see that benzidamine actually reduce the pain and dysphagia issue very significantly compared to the placebo group. And also, doctor examination shows that the hyperemia issue and also edema issue has been significantly reduced in patients on this benzidamine. Next is a comparative study of benzidamine spray as an anesthesia following tonsillectomy. So after patient will do a surgery, then they prescribe with this benzidamine spray to see the effect. So the objective to see how good is this spray to reduce the pain actually. So pain is one of the main issue that we look at here now. We also include other like sore throat, otalgia, dysphagia, or the tonsillar bed of this patient. So we see that Difflam spray really reduce the post-operative pain in children post the surgery. You can see that day 1 and day 2, right? So how good effective is using the benzidamine as well. On just day 2, it's actually reduced more than half of it. Okay. Dysphagia actually after day 2 also, you can see much patient on that. Actually, many of them, more than half of them actually significantly improve. The next one is for ulcer, because I think many people already use this product for sore throat issue, but not so many use for ulcer actually. Yeah, so actually there are this indication for ulcer. So the purpose of this study was to evaluate in subjects with painful ulcers the analgesic effect again by this benzidamine solution. Okay, so they rinse it frequently, like 15 ml for 30 seconds, and are the very important way to use a gargle correctly. Okay, so the evaluation of benzidamine versus placebo in patients with ulcers. So this is a double-blind crossover studies. So this is the object, actually they have read it, okay. So the result of this study, the pain relief score of 3.07 benzidamine was significantly superior to scoring with the placebo group. So after they used the benzidamine, they found that the pain is really significantly reduced. 61% of the subjects reported at least 50% improvement in their pain relief after using this product. The next one is a more recent study because it's talking about COVID-19. So this is the real world effectiveness of benzidamine plus quercetin sore throat. So which is a Difflam C on COVID-19. So let's look at the result. We determine the effectiveness of benzidamine plus quercetin Difflam C in elevating the sore throat pain. Okay, then this only patient with probable or confirmed COVID-19 infections. So the patient were instructed to gargle this Difflam C for 30 seconds to 1 minute for every intervals of 1.5 to 3 hours, and the duration treatment should not exceed 7 days. So there are studies for about 200 plus patients. So let us go to the result. Okay, so this is a VAS scoring. It's one of the indication used in these studies. At the baseline on day 1, that after how many hours, how many minutes, we can see that the VAS score is significantly reduced, means that actually it's getting better. Okay, so up to day 7, we look at day 1 to day 7, we can see the median score of VAS score, right? It's actually become 0. Okay, on day 5, it's actually already become 0, means that has gone to 0. Patients has no more symptom for that after using this Difflam C solution for gargling purpose. So I can see you can see how effective it is reducing the pain issue. How about adverse event? So majority did not experience adverse event, and most of the adverse side effects are mild and resolved within the study period. Most of the time will be a mucosa numbness, because of course Difflam they give you a numbness feeling and affect the taste. Okay, there maybe they can't taste well, but take note that this is also one of the side effects of COVID-19. interpretation of the result that the baseline actually is 5. So after that, use the Difflam C gargle solution for a certain period of time. And no other active medical intervention that I will mention here. There's only using Difflam C gargle solution, not other things. Okay, then they get better significantly actually after 5 days. It's totally 0 scores. So the chlorhexidine is a very special ingredient. There's a cationic biguanide used in general practices as a broad spectrum antiseptic. So they have these antiviral activities and it's very effective against lipid envelope virus like COVID-19 and influenza. Okay, however, it's not really effective in others non-envelope virus like adenovirus or rhinovirus. So a very good point here that if you see any patient with COVID-19, then I think it's very appropriate for us to prescribe the one gargle with chlorhexidine ingredient. Okay, next one is a throat lozenges with fixed combination of cetirizine, correct, and also benzidamine has actually direct virucidal effect. Okay, this study is very new, just 2 to 3 years back. So we look at how good is the studies. Okay, this graph may be a bit complicated, so I will explain it in the next slide, actually, the conclusion. So by using these throat lozenges, you have fixed dose combination of benzidamine plus the CPC, okay, show a very good and effective symptomatic relief for sore throat, but the effects on the virus has not been investigated because we don't directly test on the patient, but it's very good for sore throat, okay? So in this in vitro study as well, so CPC is a very successful bactericide ingredient, active ingredient, and also very effective against envelope viruses. So this study demonstrates that this lozenges has very strong virucidal effect with the possibility to reduce the viral load, then reduce the risk of viral infection. Meaning that if you take the lozenges, it's actually very effective to kill the virus inside your mouth cavity and also reduce the viral infection. But for whole body, there are no study yet, but for throat is definitely, or oral cavity, definitely able to reduce it very significantly. So about Difflam, so there are many types of Difflam in the market. We take 1, 2, 3, 4, 5, 6, 7 products actually. And cater for different populations, different purposes, or different age group, or the site of action of the medication, like mentioned by Dr. Lam just now. So benzidamine has over 50 years of clinical experience. It's a unique NSAID for topical application. Very good safety profile, gastro-friendly. Even if you accidentally swallow the Difflam gargle solution, actually they don't give much problem. And only if you swallow in large amount, maybe gastric stomach upset as according to NHS. So the rapid relief is targeted, very fast relief, and gives you some numbing effect. Again, we'd like to emphasize on this triple A action, anti-inflammatory, anesthetic, and also analgesic. So Difflam spray is tailored to target hard to reach inflamed and painful areas in patients with severe pain, swelling, and also difficulty in swallowing. So very good because you can target the place directly. If you spray it incorrectly or not on the location or the parts of the throat, you still can spray again until you get the correct one. Very easy to administer, very accurate dosing, and very convenient because you can just really keep it in your pocket. Okay, the action is also very fast as well. The next one is on Difflam lozenges. So actually they have two. One is just benzidamine, while the other formula is on benzidamine plus the CPC as well in 2 flavors. So this local delivery of medication is very effective to reduce the burning sensation and also swollen throat. So they give you a demulcent effect as well. Let's say sometimes they're also very good for you have a sore throat issue, just suck one lozenges and it will give you immediate relief effect. Actually, it's also faster than a systemic treatment that you're taking a swallow NSAID. And NICE guideline actually and suggested to use these medicated lozenges for reduced sore throat pain as well. Next one is Difflam gargle solution or Difflam C gargle solution. Okay, so these are targeted for very painful inflammation involving the whole mouth and oral cavity. Okay, or even like ulceration, you can use this as well. So it aims for local delivery to a larger pain and inflamed areas in the oral cavity, gives a local relief of oral lesion, and also gives soothing and refreshing sensation. So gargle this, okay, take a capful of the solution, gargle 15 to 30 seconds. I recommend 30 seconds and spit it up after that. Do not swallow. Then you can repeat in 2 to 3 hours. Okay, next, we go to our sore throat cases for today. So we look at Sophia. She's a 35-year-old woman, has a sore throat started 2 days ago, or the pain is happening while swallowing only. Maybe possibly due to overeating of Chinese New Year cookies, but now maybe it's another type of cookies already. So she has a slight cough with phlegm for 3 days already and no other symptoms. Maybe you will ask, what color is the phlegm? Okay, so it's actually no color, colorless phlegm. The temperature now is 36.9 degrees Celsius. The notes are not tender when touched, and this is the throat of the patient. There's no known allergies, no known medication, generally healthy, and there's no other condition for this patient as well. So do you still remember the MAC scoring? There are 5 criteria that you should always remember for this MAC scoring. We look at the age, okay? We look at the condition of the cervical node. We examine the throat as well, see on their is there any swelling. They check the temperature and ask the patient on the age as well. Extra one slide. Okay, so what is the MAC scoring for this patient? I didn't put the picture just now, so yeah, you can just use the emoji. I think the first emoji on your left should be indicating clap is a 0, thumbs up is 1, it's like a crying face is 2, wow is 3, heart is 4, was this celebrate is the maximum 5 scores. You see, like, clap, right, clap. Okay, I think most of you all rated 0 or 1 scoring only, right? So I suppose you all get it correct, because 0, no matter it's 0 score or 1 score, actually it's more to a viral etiology instead of whether they need antibiotics or not. So actually we can just give them some symptomatic treatment based on the condition, or give them something to reassure that it's a viral infection and they might not need to demand any antibiotics for that. So 35 years old is a 0 score. Okay, so pain while swallowing, but actually there's no other symptom, not fever as well, and only have a coughing issue only. So for coughing issue, actually 0 score over here. Okay, then this the note is also not tended. Okay, so actually this is more like a viral origin. Okay, so the next one. So as a pharmacist, so when should we refer to a patient? Okay, very important is that after we counsel the patient, if we found that the patient is on a certain MAC scoring, then we need to tell the customer, right? Okay, then over here, maybe I will answer one of the questions in the Q&A first. I think everyone can see that on the chat box. Score 3, treat symptomatic only, not refer for swab. Okay, so if the patient is having a score 2 to 3, actually we need to treat the symptomatic only. And there's in the slide, we also mentioned that if the patient, you can tell the patient if you still have any symptom after 3 to 5 days, then you can refer. Okay, we don't need to treat the symptom, but we will tell the customer that you should refer to a doctor for a swab if you didn't get well after a few days. So at least this is a very important message over here. So when to refer to a patient that maybe we see some red flag symptoms, or there's cases that are very serious, where we can see the MAC scoring to be more than 3, 4, 5. Okay. So when to refer, the first point will be a severe sore throat more than 1 week. Okay, of course, if you treat something more than 1 week, it's still not resolving, it's very dangerous. And we need to think of any other underlying causes that cause patient to have unresolved sore throat. Maybe like the factors as mentioned by Dr. just now, like maybe cancer or any other very serious issue. The second one is high-grade fever, it's very high fever. The third one, red swollen tonsil with patches of exudate, like the whole mouth full of exudate or patches as well. The fourth one is swollen vaginal lymph node, means not only the anterior cervical node, but where whole body lymph node are swollen. This is a very serious case as well. The next one will be a frequent recurring sore throat. Next one, difficult in swallowing, that cause them to have malnutrition, maybe their body weight drop a lot. All this we need to refer to a doctor for further examination. And next one is a joint pain or ear pain with swelling of neck as well. Last one, most important, since we emphasize a lot on this MAC scoring, if they get more than 3, we treat them with basic symptomatic relief at the point of time. After that, should be do referral. Doctor can do some swapping after that. This will be more from a community pharmacy perspective. Okay, So for what the counseling points, I think actually doctor also mentioned most of them just now, that you can suck on the ice cubes or consume ice cream for soothing effect, and gargle salt water, more like a traditional method, but actually it works quite okay. Clear plenty of rest, drink more plain water, tea or honey lemon as well. One thing remember is to take more soft food, okay? Because like Dr. mentioned just now, we don't reduce the friction, but you make sure the patient takes something to get enough nutrition. The last one will be to rest your voice, because we talk a lot, then maybe you can get sort of more serious by the time. Okay, so that's all for my sharing for today. So we are open for any question and answer session. Okay, let me look at the question and answer part. Okay, the first question will be, what is the expiry date for the Difflam spray once it has been used or opened? So actually, I think they don't have a very direct guide on how long it should preserve. But as a general rules of thumb that in my practice, for any this kind of reusable devices, I recommend them to dispose or change a new one if they frequently use it, like after 3 to 6 months. I think there's a safeguard on it, because they actually don't have any studies on the quality, because of course this they has a preservative, but with the design of the different throat spray, that doesn't prevent any bacteria from going in. It's unlike certain eye drops. So there might be bacteria, and we're not sure how the customer is keeping it. So usually we prefer to say 3 to 6 months after opening it. Okay, we do have some question in the chat box. Could you provide a guidance on the proper usage of the Difflam mouth rinse, including the dosing frequency or any specific instruction or precaution the patient should aware? Okay, so for this Difflam gargle, right? So usually we suggest you to gargle it directly. Okay, you don't need to dilute. You just gargle it directly. So you can use a capful, because actually Difflam, I think you can see right my picture here. So Difflam here, so they have a cap. They have a cap over here, right? So or if you have the measuring cup, you can take up to 15 ml. Okay, then to gargle every 1.5 to 3 hours. You can repeat many times per day actually. Even if you accidentally swallow it, actually you don't need to worry, because it actually won't cause much side effect on this. Okay. Any specific instruction, maybe I would say do not swallow up, because I think it doesn't taste good in your throat if you just directly drink it, right? So I think it's very important to ask the patient to make sure that they can gargle, then you need to prescribe the Difflam gargle for them. Okay. May I know if I can use, okay, another question. May I know if I can use benzidamine gargle regularly to prevent recurrent mouth ulcer? Okay. So it depends. I think it depends on the frequency. How frequent is the mouth ulcer issue? If the patient having like every month they get a mouth ulcer issue, right? So I think we need to identify the cause first. Is there any underlying the patient is having cause them to have like frequent mouth ulcer? I think this is actually very relevant to you, doctor, right? Just on the question also on this,
I think I need to it doesn't prevent. The medication is to treat for symptomatic treatment. It doesn't prevent the occurrence of the next ulcer. So it's not something preventive medication.
It's not for prevention. It's only for that moment to treat the symptom only.
So if you don't have ulcer, don't use it.
Yeah, correct. Okay. So another question over here, that can patient use benzidamine rinse and lozenges together or choose one? Oh, I think doctor actually answered just now. So I would like that we emphasize that actually benzidamine, if necessary, you really indicated, actually you can use 3 formula together. You can use spray, okay, on the targeted throat, like sore throat, very swollen already. Second one, you can use gargle if your whole mouth like other ulcer as well. And the third one is lozenges if you have only will get some demulcent effect. Actually, based on the condition of patient, like which side is affected, then you can prescribe accordingly. But of course, if customer got no budget, got budget issue, then you might need to choose the most suitable one.
I got a question to you. Can they use? I mean, I mean, maximum dose. I mean, all three maximum dose. I mean, if they say that spray, they use 4 spray, then they gargle, then take lozenges at the same time. Should it be okay?
Actually, all these medication, they are aimed for this local effect only. So basically, of course, they don't have a good study on like how much you can use, but actually you can use all together at the same time. It also won't cause you like any overdose because actually they are quite safe as well.
Yeah.
Right.
So after I use all this, I have seldom see any adverse event, even allergic reaction we don't see. Yeah.
Okay. So we have the next question for the phlegm throat spray. What is the age that can be started? Okay, the phlegm throat spray is recommended for more than 6 years old. Okay, if more than 6 years old children, then you can spray lah. If 6 to 12 years old, you can use the spray 2 times, spray 2 puff directly on the affected area. Okay, if for adult, actually you can spray up to 4 times lah, because like more maybe more swollen or more serious, then you can use more spray actually, and you can use very frequent, like every 3 hours is also good enough. Okay. Actually, I think this participant is from government setting. It is A star. A star is referring to a specialist only item, right, in government. So yeah, maybe because of I think it's budget issue, lor.
Yeah. In certain hospital, the Difflam or benzidamine can only be prescribed by ENT specialists and oncologists.
Yeah.
Or some certain oral maxillofacial surgeon that is related to our field.
Yes, this is related for government-related hospital, but in private, actually, patient more than 6 is started if it's really indicated already. Okay, so we have this next question on how to choose which to give between the phlegm or the phlegm C gargle. So maybe we look at how this extra, the word C, right, is an extra this CPC ingredient as well. So CPC ingredient, like I have mentioned just now, is also, it shows a very good virucidal effect for this COVID-19 as well. So of course, if you ask me, actually both you can use for this kind of patient, but if a patient with for this, you know what kind of infection is that, like COVID-19, then obviously this additional CPs were more effective and they give you a better effect instead of just a normal Difflam. But actually both you can use for this kind of population as well. Doctor, you have anything to add on?
Yeah, it's just Difflam C is just an addition of chlorhexidine besides benzidamine. So it's an addition of antiseptic. If you think that the patient, it's just an additional effect probably to the virus and to have some bacteriostatic effect. Yeah.
Yeah. It's an addition of the, just I'll say wrongly, it's not CPC chlorhexidine. Okay, the CPC one is the lozenges.
Yeah, lozenges is CPC. The gargle is chlorhexidine.
Okay.
Yeah, maybe I can ask you a question. According to the chat, the question they asked, they say customers sometimes prefer Difflam AB lozenges at OTC counters. Can the lozenges trade sore throat?
Okay, usually I will mention in my comment setting, I will tell them like this. So because OTCs, you can get it easily. So their effect is not really counted as a real medication in Malaysia. So I would say this inside one is inside the shelf one, they actually they give you a triple action on this. So usually I will mention this word like they give a multiple effect instead of just the normal Difflam AB. Yeah, so I think depends on the patient condition. If they have this effect that they want, like the numbing effect, if they want it, then I think Difflam the shelf one is a much suitable choices instead of just normal antibacterial properties. Yeah, I think why they have Difflam AB because I think they want to reach, they can reach more customer base because you can get in convenience store. But for medicated, then we can need to advise them on the use of Difflam as well. Then we can tell them how to use. And very important, we need to counsel them or to refer them if they really need any additional helps on that.
Okay, next one, the question is, does benzidamine lozenges excreted in breast milk?
Okay. Oh, this is a question. Okay, actually it depends on the different guideline. I also go through a few guidelines on this. So benzidamine lozenges will be actually might be excreted in very low amount only, but basically there's no studies, and it's actually unlikely to cause any effect. Even according to NHS England, they just say that it's unlikely to cause any side effect because even if you excrete, it's in a very small amount. And the reason they are not using in pits is actually because they don't have any study on that, like Doctor mentioned just now.
Here, the next one, not sure question to you or to me, is it painful swallowing, is it different from tonsil swelling? Kind of confused with the symptoms.
Okay, I think Doctor can answer this.
Yeah, actually it's different. Painful swallowing, or we call it odynophagia, is just a patient when they feel painful over the throat. It can be just inflammation over the throat. It can be due to tonsillitis as well, and it doesn't mean the tonsil must be enlarged. Okay, or in another condition, the tonsil enlarged is big. We call it hypertrophy. It may not always cause pain as well. It may not cause sore throat as well. In those kind of patients, like especially you see those chronic smokers or in pediatric that have a history of recurrent tonsillitis, their tonsils are much bigger than the normal condition. So these tonsils are large, but they are not inflamed and they don't cause sore throat. So if the tonsil is large, you do not treat large tonsil by medication. It cannot be shrunken by given throat gargle or this. You only give gargles if patient have inflammation or infection over the throat. And if there's no inflammation, only large tonsil, no need to treat. If it's cause symptoms, I mean the tonsil is too large, it's caused problem to the airway, breathing, or that, actually the treatment is surgery to remove the tonsil.
Okay.
Okay, next question to you is, and what's the difference between benzidamine and cetirizine in terms of efficacy and safety?
Okay, I think the benzidamine is I think we are referring to the Difflam, while the CPC referring to the maybe Difflam, they are lozenges, right? They inside there this CPC ingredient. So both of them are very I would say benzidamine have triple action, but cetirizine they don't have. Okay, there's more to the antibacterial properties. Okay, so if I think I have one tips for my staff as well. So if you always, maybe not always, maybe sometimes you forgot what are the difference between the Difflam. Sometimes we confuse. I teach the staff like that. So I will arrange the Difflam together. I think you all can see my picture, right? Can see. Okay. So we arrange the Difflam together side by side. Okay. So I will arrange in this way. It's easier that we arrange this one first, the green color one, the mean one. Okay, maybe on the most left side. Then we arrange the other two on the right side. So that we know that the left side is not so strong one. Okay, of course, not so strong, meaning that they have maybe one ingredient. They have only the benzidamine, the 3A action. While the honey lemon and the raspberry one, they have an additional CPC function as well. So basically, CPC is more to antibacterial or antivirus direct properties. Okay, while the other one is more to anti-inflammatory or the the numbing effect. Yeah, they give you this different kind of effect. But of course, the taste it will be different lah. Okay, because they only have one flavor for this the normal one, or two flavor for the other two. Okay, so they are very safe, but we recommendation you don't take the whole box per day. So recommended you can take my own recommended to prevent them to take over. I would say 8 tablet per day, but actually the lozenges you can take like 12 lozenges per day is still very safe. Okay, but like you can take once like every 3 hours lah, or every 2 hours. You don't like swallow the whole box directly. Yeah, it's meant for lozenges for sucking purpose, not to swallow. Okay.
Yeah, next question to you. Which one is recommended? The lozenges taken together with serotiopeptidase or lozenges only would be suffice?
Actually, I think this is referring to a sore throat cases.
Yeah, I think so.
For sore throat, actually, I also not so common to give seropeptidase.
Yeah.
I think you Doctor mentioned also like a puppies, right? It's very similar.
Yeah.
Not so common, I will give this lah. If the patient is usually patient mindset is like this. If they want something fast, but then you can recommend more than one product, but different mode of action. So let's say they want something they're okay with swallow medication. Maybe I give a simple NSAID, then with a spray. Or they're okay with lozenges, we give lozenges plus a spray together. So usually, I will give more than one in my practice. I don't really like just go with one. Because patient actually they come to you, they expect something really fast for them. So usually I will give more than one. I will offer them. So we have these lozenges to soothe your throat, while the spray can give you the numbing effect. So they are okay with that.
Yeah. I think if you really need some oral medication, I think a paracetamol will be sufficient. If it doesn't work, and you may consider some NSAIDs, but do not give NSAIDs at the first place to all
Yeah,
patients.
correct. Because
And,
usually, yeah,
no, you can continue.
yeah, I think NSAID has also, of course, a higher risk of side effect profile, right? Then we need to ask more like, do you have gastric issue? Do you have allergic issue? And if sometimes they never try NSAID in the whole life. So then maybe first thing, then they got the allergic. Then it's a bit difficult, a bit tricky here lah. So usually for like first patient, I wouldn't try NSAID directly. Unless they have been using that, then they think it's quite well. So maybe we can have a simple NSAID, then plus a lozenges or spray. Actually, spray is my favorite over
Yes.
all this. Because actually,
My favorite also.
myself also use spray for like
Correct.
when I got
I
COVID,
think
I also use spray.
for my patient, the spray can reach more deeper and lower down, because if you want to use gargle, a patient really need to gargle properly, not only gargling the mouth, because most of them they gargle inside the mouth only. They don't really reach the posterior part, the throat, correct? They only gargle, so it's not really effective. So if you know that they don't gargle so well, so it may give a throat spray. Yeah, it works better. This one to you, the question is for Difflam gargle, do we need to rinse with water after use?
Usually no need. Because if you rinse with water, then your medication somehow will be gone a bit reduced already. So usually you just directly gargle already.
Because the effect of the medication depends on the contact of the medication and the mucosal surface. If you immediately rinse it after that, then the effect will be less.
Of course, if you use spray, we also won't recommend we drink water or just gargle.
Yeah, correct. Next one to you, do you have Thymo gargle in your setting?
Also, I think this question is for you. Because
really?
pharmacy, we should have Thymo gargle.
Okay. In my setting, if you see my clinic, I almost nowadays I almost never use Thymo gargles, because for me is what's Thymo actually? What's the effect of Thymo?
Usually it's like a soothing.
It's just soothing, like not even the anti-inflammatory, right?
Yes, correct.
So yeah, but because of the cost, government hospital, because of the cost, all this, and it's still used a lot in clinical settings and in even emergency department. It's used a lot, but it doesn't really relieve the sore throat. It just gives some soothing effect. Yeah, in my clinic, if it's due to inflammation, I don't give Thymo. I give something really anti-inflammatory. Yeah.
I think the main issue here is because they don't have the anti-inflammatory properties or the numbing effect, which sort of really need that treatment.
So if sometimes let's say if those doctors working ED, they don't have access to prescribe, actually they can advise patient to buy in pharmacies. Yeah, that's what we do actually. Even in clinical design, they can advise patient to buy outside. Then patient will be quite happy to get something that relieve their symptom. Yeah. The next question probably to me, they say hoarse voice that had just started, noted that it's self-limiting, but is there anything we can give to improve the voice faster? The answer is no. If there is any inflammation already there in the voice box or the vocal fold, actually what you need is do less. That means don't talk. Rest your vocal fold and ensure adequate hydration. You have to drink frequent small amount of water to ensure adequate hydration. If you have reflux problem, gastroesophageal reflux or laryngopharyngeal reflux, we need to treat the reflux with proton pump inhibitor and control the diet, less coffee, less all these foods or spicy foods, so that can trigger the acid reflux, and adequate sleep and adequate rest, more water, rest the voice. The hoarseness or the laryngitis will go away, usually within 3 to 5 days. Yeah. But if you keep on talking a lot, you use your voice a lot, then the hoarseness will persist longer. Next question to you, does length of time for gargling, rinsing, spraying will affect the action of benzidamine? For example, if only gargle for 15 seconds compared to 30 seconds of gargling. Good question.
I think it's very relevant.
They put in mouth for 5 minutes.
Yeah, they hope they can kill everything. So basically the concept of gargling is like this. So of course, when you gargle 15 seconds, you might only able to gargle your mouth cavity only. If you're able to ask the customer to gargle longer, they will, because the water in your mouth already, sometimes they feel boring or this space. Maybe they gargle this space more, and go to the throat. That's why you need to tell the customer to gargle properly, not just outside the mouth only. So they can move here and there so that they really gargle all the parts. They only fulfill the purpose as a gargle, especially patient with multiple ulcers. If you gargle at the place without any ulcer, then it's no point.
Yeah.
So I think asking them to gargle 30 seconds is one of the reasons, is to make sure they really gargle the whole affected area.
Yeah, for me, if I advise my patient to make sure they really gargle the throat, I usually ask them to look up. They need to really look up, and they really need to and listen the voice, hear the voice, then it's memang is at the throat. It's gargle. If not, they only gargle the oral cavity. It doesn't reach the throat. Yeah, I think it's okay. We do that. We just, accidentally drink a little bit of amount of gargling. I think it's still okay.
Yeah, it's still okay.
Yeah. The next question to you also, Ben, what can patient expect in terms of relief and time frame when using Difflam for oral discomfort? When should they seek further treatment if improvement is not observed?
Okay, so I think it depends on which product that you are talking to about. So let's say a Difflam Thought Spray, I think is the fastest action for me. Okay, in my personal use of this Difflam product. The spray is the most directly acting one because they spray on the affected area. You can see the effect as early as I think is 10 to 15 minutes. You can see the soothing already. Then after half an hour, you can see the full effect is already recovered. But one thing that you might need to know that because sore throat sometimes the inflammatory gone, it's at your throat, right? You talk, you drink water, it will remove the medication, stay at your throat. So after 2 to 3 hours, you might need to repeat to spray again. Although it acts fast, but for me, it's a bit not so, of course, it's not long lasting because you drink water and saliva is moving in, right? So very important, we can use it more frequent and it's actually safe. This is one very good thing about this spray. I think for gargle and lozenge, lozenge is more like a temporary relief for this condition. Usually, there are other things that are able to like reduce swollen with the medication or the gargle or the spray directly. So for the gargle parts, right, or the overall, we can use it actually very frequent. So that every 3 hours you can gargle already. Until even in the clinical studies that you can use it 1.5 every 1.5 hour gaps. But of course, you use a lot, maybe you use 1 bottle in 1 day. Okay, so if you can use more frequent if necessary, usually I recommend is 3 hours. Every 3 hours, then you can use the Difflam. So in terms of the relief, actually, for me, spray is the fastest. Then after that will be lozenges, then the gargle. Gargle will be slightly slower, but I think they give a very good effect as long as you gargle it properly. They can really gargle it inside. They give a longer effect than the spray, in my opinion. Okay, then let's say when they should seek further treatment, in my daily practice, usually, I think in my slide I mentioned that we refer it for more than 7 days, but I think 7 days is quite long actually. So in my practice, I recommend to seek a doctor opinion. If there's no symptom relief at all, means they use everything but nothing happened. Actually, 2 days they should go refer already.
Or the symptom become worse.
Yes.
Even though they're taking medication, the symptom become worse, then you should seek treatment.
Yeah, within 2 days, they should go to refer. That's why we need to tell customer always, you can use this product first. If not going better in how many days, you can just, based on your practice, then you can tell the customer to refer for a doctor, maybe other symptoms that might need antibiotics or any other underlying causes. But let's say they feel it's better, but maybe not fully resolved, actually they can save to use methamphetamine up to 7 days, still very safe. If let's say if they are not so frequent using the spray, right? Let's say like when I got COVID the other time, right? So I use spray, but not very frequent, maybe 3 times per day only. Then of course I use more than 7 days, but still very safe. I think that's how we tell the customer that the referral should be based on the symptoms actually. If the symptoms get worse or didn't resolve at all at 2 days, then they should be referred immediately, or then get the treatment getting better. If it's getting better, then it's okay. They can use a longer period.
Next question to you. Any comparative studies between Thymol and benzidamine?
I think this product should have a lot in the market. Should have a lot already in the studies, but we didn't include anything just now because like I mentioned, I think benzidamine has this triple effect that Thymol don't have. I think this is a key difference and very obvious that we want something anti-inflammatory, when something have numbing effect, then it's very obvious that benzidamine is a good choice instead of just Thymol.
So I see one question, but I couldn't find it. There's the participant asking, should you treat, let's say the patient is less than 15 years old, fever with enlarged tonsils, should you treat all with antibiotic? But I think if you look back at the criteria, or McIsaac or modified Central criteria, it has to be quite specific. A fever has to be documented more than 38 degrees Celsius. the tonsil has to be enlarged and have a surface exudates. If it's just enlarged, inflamed, it shouldn't count as 1 point. And the lymph nodes location as explained by Winky, it should be that specific location. If it's at the posterior part of the neck, at the back, it doesn't count it as an enlarged neck nodes. Okay, there's a more to virus infection. So you have to follow the criteria strictly. So cannot say any enlarged tonsil, then it count as 1 point. Yeah, because it can be just virus infection.
I think that's all from here. Okay.
Yeah, I don't see any new question coming in. Yeah.
Okay, no more question. If you have a question, you still can type. So meanwhile, I will just continue from the SwipeRx part. Okay, got one more question. I think just now, I think doctor also mentioned a bit on this for this pediatric population. Sorry. The question is there any other condition where benzidamide is not recommended besides of like small children?
Allergy, we're non-allergy to benzene. The patient, let's say patient used the product before, then it develops an allergic reaction. And usually this allergic reaction is local allergic reaction. They cause mucosal edema, or even worse, patient have anaphylaxis kind of reaction. Then you shouldn't go and try and ask patient use again. Yeah. But other than that, I don't usually see any common side effects or any contraindication using benzidamide.
Okay, thank you, doctor. So maybe we can move on to the poll question. So this is my question. So yeah, so what is the primary pharmacological property of benzidamine hydrochloride? So I think this answer, I think we should just give 10 seconds for this question. We have mentioned multiple times on this. Is it anti-inflammatory only, or is it analgesic only, or is local anesthetic? Okay, but we have tricky part also here, because got one answer is all of the above. If choose one, I think everyone can get it correctly. So the answer, yeah, I think it's very obvious for this. Maybe have another 10 seconds for these questions. Okay, so we look at the poll. So what is the primary pharmacological properties of benzidamine hydrochloride? So actually, all the above are the primary pharmacological properties, and they have these three very important, very good properties that I would say better than many other products. Okay, not to say not good, but it depends on the patient condition. Okay, we look at the underlying causes or the presenting symptoms. Then we go to the second one. Okay, yeah, okay. So this is one of the things that we both of us mentioned many times. So which factor is not included in the MAC-Isaac scores for assessing the severity of a sore throat? Okay. So the question, the option are, which factor is not included in the MAC-Isaac scoring for assessing the severity?
While we're waiting, some of you may be questioning why that different name, Centaur, some use Centaur score, some use MAC-Isaac. Actually, it's almost same. Initially, Centaur scoring come first, then this person called MAC-Isaac and go and take this Centaur score, they modify the Centaur score. The additional criteria they put in is the age criteria. So we call it modified Centaur score. Actually, it's equivalent to MAC-Isaac scoring. Actually, the same criteria. But the criteria has to be specific, according to the cutoff point that they set. So over here, we share the result. So the first thing, the temperature. Okay, temperature is one of the method scoring, but we don't say like a normal 37 is considered a high fever or that. So we have a very specific method scoring for that. And the second one is tonsillar swelling exudate. We include this as well. Patient age less than 14 or more than 45, they give a positive or negative scoring on this. And the last one is duration. So the answer is duration of symptoms. Actually, it doesn't matter. The duration, yeah, doesn't matter. I'm a bit surprised still some doesn't get, because we repeat this many times. Yeah, if you don't have, please Google modified Centaur or MAC-Isaac scores available anywhere. So it's even some you can just directly fill in. You can automatically come out
for you.
Yeah, count for you. So that automatic calculator. So it's very useful for you, I think. Yeah, you don't need to fill in the calculator. Yeah.
And actually only 5 factors, so I think it's very easy to know. It's like the Framingham score is more difficult, right? So this is considered very easy scoring that we can apply and in our daily setting actually.
Yeah.
So, okay, the last poll for today. Okay, so this is a true or false question. Chlorhexidine ingredient, Difflam C, has shown resolution of throat irritation COVID-19 patient without the need of active medical intervention. It's actually mentioned in one of my slides, so I also emphasized it, but I'm not sure, maybe some of them are busy. Okay, so chlorhexidine Difflam C has shown resolution in throat irritation in COVID-19 patient without the need for active medical intervention. So in that study, they didn't use any medication besides of Difflam C. So does this product able to help COVID-19 patient?
Provided the COVID-19 is not severe,
Yeah.
doesn't involve the lungs or the category 3, 4, 5 kind of thing. Yeah.
Yeah.
So if it's a mild symptom or the throat symptom, yeah.
Maybe you have another 5 seconds. Okay, so these are the results from our participants. So the answer is actually true. So most of them get it correctly. That actually can reduce kill the virus, so resolution in the throat irritation as well.
SwipeRx.